There was a time when falling sick in Burkina Faso felt like a death sentence. Not because of the illness, but because there was nowhere to go. No doctor, no medicine, no hope. Mothers gave birth in darkness. Children died of infections that a simple antibiotic could have cured. And those who could afford it fled to other countries for care. But what if we told you that's changing? What if we told you a hospital is rising from the red soil of Bobo Dioulasso, not just to treat disease, but to heal a nation's spirit and reclaim its sovereignty? This isn't just a building. This is a revolution in white coats and the world. It wasn't ready for a hospital like this. Welcome to Bobo Hospital, where healing is no longer outsourced. It's owned, it's African, and it's unstoppable. Before you can understand the revolution of Bobo Hospital, you have to understand what came before it. In the dusty outskirts of southwestern Burkina Faso, under a scorching Sahelian sun, mothers once walked for hours, sometimes days, to reach a clinic. They carried their babies in faded wraps, clutched water bottles for the road, and prayed that the nurse hadn't gone home, that the medicine hadn't run out, that there would be someone, anyone, who could help. Too often, no one came. Burkina Faso's healthcare system before Ibrahim Traoré was fractured, underfunded, and forgotten. A patchwork of rural posts and overwhelmed city clinics tried to cover a country of 22 million. But the truth, for millions, there simply was no care. In entire provinces, there was one doctor per 25,000 people. 80% of rural clinics lacked basic supplies like IV bags, sterile gloves, or oxygen. Ambulances were so rare that most emergencies were handled with motorcycles or donkey carts. This wasn't just a system in crisis. It was a system designed to fail the poor. "My wife gave birth on the side of the road," said one man outside of Bobo Dioulasso. "We named our daughter Timbo, which means dust, because that's what welcomed her into the world." But what made it worse was how normalized it all became. Donor aid came and left. NGOs arrived with their own timelines. Foreign doctors flew in, stayed 3 weeks, and left. The people stayed behind with no continuity, no equipment, no sovereignty. The capital, Ouagadougou, had a few functioning hospitals, but they were overcrowded, expensive, and urban-centered. Patients from the south and west were routinely turned away or made to wait for weeks. Rural areas, like Bobo Dioulasso and its surroundings, saw sky-high maternal mortality, untreated infections, and preventable deaths rise every year. A nurse in Diebougou confessed, "We have one delivery bed, no surgical tools, and power cuts that last all night. When a woman bleeds, we light a candle and pray." And yet, when the government spoke of reform, what did they propose? More dependency, more wait for international loans, more half measures dressed as progress. No one dared say what the people already knew. This system was not failing. It was never built to succeed for them. But in 2022, a change began to stir. And when Traoré came to power, he asked a question most leaders fear to voice. What if we built care not just as a service, but as a sovereign right? This wasn't about clinics with Western flags. It wasn't about aid effectiveness reports or photo ops with donors. This was about reclaiming health as a national duty, rooting care in the soil of Burkina Faso, and ending the quiet genocide of neglect that had taken too many for too long. A people that cannot heal its own wounds will never be free. Captain Ibrahim Traoré. It didn't start with bricks. It started with a promise. In a speech delivered behind no golden podium, with no Western dignitaries in sight, Ibrahim Traoré looked into the eyes of mothers, elders, and village chiefs in Bobo Dioulasso and declared, "We will no longer outsource our healing." It was a bold vision to build a world-class hospital not in the capital, but in the heart of a region long neglected by every previous government. A hospital where Burkinabe would be cared for by Burkinabe, where healing would not just be delivered, but owned. But Traoré's plan wasn't just to build a building, it was to rebuild belief. For decades, Burkina Faso's citizens were conditioned to see hospitals as foreign gifts, funded by aid, staffed by outsiders, managed through international directives. The idea that a sovereign state, newly stabilized and under siege, could undertake such an ambitious health infrastructure project was seen by many as impossible. But Traoré and his administration saw it differently. They saw a country rich in willpower. They saw engineers and students eager to serve. They saw communities that didn't need charity, they needed a chance to lead. So the vision was clear. Build a hospital that belongs to the people. Train the people to run it. And make it the first node in a new national health system. The principles of the vision. 1. Decentralization. No more capital-only care. Traoré chose Bobo Dioulasso, the country's second-largest city, to begin the shift of resources westward. He said Ouagadougou cannot be the only place where life is protected. 2. Sovereign workforce. From the start, the plan prioritized training local doctors, nurses, and technicians. Medical scholarships were expanded, health schools upgraded, and diaspora professionals were invited home on national terms. 3. Technology with ownership. The hospital would not rely on fragile imported systems. Instead, it would be powered by solar energy, supported by Burkinabe-built IT systems, and use open-source medical software to ensure accessibility and sustainability. 4. Community first. Villagers weren't just consulted. They were invited into the process, from design workshops with elders to local employment in construction. The hospital would reflect the culture, climate, and needs of the region. A young nursing student in Bobo said, "We were taught to dream of working abroad. Now, we dream of serving right here." What makes this different from the past? Past projects funded by donors came with long strings attached: outsourced procurement, imported management, unstable maintenance. But Bobo Hospital's funding was structured through state investment, BRICS-aligned financing, and regional partnership agreements, all under Burkinabe control. This wasn't a handout. It was a stake in the future. As planning advanced, something else emerged: a new language of public health. Ministers stopped speaking in targets and donor metrics. They spoke of dignity, access, and sovereignty. Billboards in the city read, "A new hospital, a new era, healing by our own hands." More than architecture, more than policy. This was an emotional pivot. After generations of being told they had to look outward for healing, the people of Burkina Faso were finally told, "Look within, we are enough." It started with earth, red, warm, and stubborn. The same soil that once buried dreams, now forming the foundation of healing. The construction of Bobo Hospital wasn't quiet. It didn't hum like a foreign-funded project, hidden behind tarps and gated fences. It roared with hammers, shovels, laughter, and song. Because this time, the people were building their own future. Local hands, local hearts. Over 75% of the workforce came from within Burkina Faso. Bricklayers from Bobo, electricians trained in Ouagadougou, women from nearby villages managing logistics, catering, even security. What once would have gone to foreign contractors was now fuel for the local economy. And something extraordinary began to happen. Young people stopped leaving. They stayed. Not because they had to, but because they finally had something worth staying for. Tech meets tradition. This wasn't a concrete monster. It was a fusion of modern engineering and climate-conscious design. Walls made from compressed earth blocks, naturally cooling the wards. Solar panels lining the rooftops, powering emergency systems and operating rooms. Rainwater collection built into the architecture, feeding irrigation systems and sanitation units. Every corridor, every wing was built with intention to serve, not impress.
A classroom disguised as a construction site. The hospital wasn't just rising, it was teaching. Local university students in architecture, engineering, and medicine rotated through the site sketching, measuring, asking, learning. One civil engineering professor said, "Our textbooks are being written in real time and they're in Bobo."
No blueprint for dignity. Traoré wrote one. He visited the site weekly not for photo ops, but to ask hard questions. Are we using Burkinabe materials? Are we training enough technicians? Are women being hired, paid, respected? He pushed contractors to do better. He pushed the government to invest more. And he pushed the people to believe not just in the hospital, but in themselves. Milestones and miracles. By month 6, the foundations were complete. By month 12, the wards were up. By month 18, the lights came on powered by the sun. Not Paris, no delays, no scandals, no excuses, just progress. This is more than a hospital, one worker said. It's proof. Proof that sovereignty isn't abstract. It's steel and sweat, hope and hardware. And in Burkina Faso, it's rising from the ground up. Bobo Hospital was never meant to stand alone. It was built to be a heart-pumping trained minds, modern tools, and renewed confidence into every corner of Burkina Faso. And now, the arteries are forming. A network begins to breathe. Within months of the hospital opening, construction began on 12 new rural clinics, not massive, not flashy, but efficient, solar-powered, and connected. Each one linked directly to Bobo's central system via digital networks. Patients in remote villages can now get basic care and referrals without traveling for days. Nurses in the field can send real-time health data to doctors in the city. Medical supply chains are tracked digitally to prevent shortages. Burkina Faso wasn't just treating illness, it was building a circulatory system of care. Real stories, real impact. In the town of Sindou, a woman gave birth safely in a new clinic assisted remotely by a doctor watching live vitals from Bobo.
In Dori, a child with a severe infection was airlifted using new ambulance protocols survived because the system responded in hours, not days.
These aren't miracles. They're what happens when sovereignty meets coordination. The map is changing. Previously, health infrastructure was limited to a few cities. Now, an entire web is growing. Referral centers in rural hubs, training institutes for nurses and paramedics, emergency call centers with GPS dispatch. Each of these nodes reduces pressure on Bobo Hospital and extends its healing reach. Where once people asked, "Where can I go for help?" Now they ask, "How fast can help come to me?" Training the next generation. The Bobo Regional Hospital is not just saving lives, it's creating healers. A new generation of Burkinabe doctors, nurses, and technicians is being trained right here. No more sending students abroad only to lose them to foreign hospitals. Now, they stay, they serve, they lead. In the first year alone, over 320 students enrolled in clinical rotations. 88% of them signed contracts to work in the national public health system. Numbers that speak louder than aid. Infant mortality in the Southwest has dropped by 18% since the hospital opened. Rural vaccination rates are up 30%. Emergency response times in the region have halved, and the government isn't hiding behind these numbers. They're building on them, replicating the model in other regions. Fadan Gourma, Wahiguya, and Gawa are next. A people awakening to possibility. For decades, healthcare was a whispered word, something distant, foreign, unreachable. Today, it's spoken aloud in villages and cities alike. It's planned. It's owned. One nurse said, We're no longer just saving lives. We're changing how people see their lives. This is the quiet power of a sovereign system, not waiting for aid, not begging for expertise, but building a structure where life can thrive, nationwide. And it all began with a hospital that refused to be ordinary. You see, this was never just about hospitals. It was never only about beds, or budgets, or even lives saved. This was about dignity. For decades, Burkinabe mothers gave birth on dirt floors. Fathers died of infections treatable with $5 antibiotics. Children walked for miles, not for school, but to carry their loved ones to help that never came. And the world said, that's just Africa. But Traoré's government said, no, that was colonialism's aftershock. This is the healing, the symbolism of care. Bobo Hospital became more than a medical center. It became a temple of sovereignty, built not to impress donors, but to serve citizens. Staffed not with foreign missions, but with Burkinabe talent. Connected not to extractive industries, but to rural villages, mothers, farmers, workers. This is the face of independence. When a sick child walks into a clean, functioning clinic and leaves alive with a future, a different future begins here. Look closely, and you'll see what's really happening. A nation no longer outsourcing its healing. A people no longer begging for help. A government investing in life, not loans. Burkina Faso isn't chasing the West. It's redefining what success means in Africa. And it's doing so by design. One clinic, one birth, one heartbeat at a time. The world is watching. Some are shocked, some are silent, some pretend not to see, but they will. Because a nation that builds its own hospitals, trains its own doctors, and saves its own people is a nation that cannot be ruled. To the audience, if you believe that true power starts with care, if you believe that sovereignty is not just political, but personal, then share this story. Because this isn't just about Burkina Faso, it's about every African nation reclaiming the right to heal itself